Hi everyone, welcome to my channel Medical Alls. Today we are going to discuss about anti-anginal drug. Okay, or you can say that drug which are used in the treatment of angina. So recently I have uploaded a video of anti-hypertensive drug. So today we are going to discuss the next drug, anti-anginal. If you see the drug which are used in hypertension and the drug which are in anginas are mainly similar. Some new drugs are added that also you are going to discuss. So first we are going to discuss about what is angina, okay, and what are the symptoms we are going to discuss. After that we are going to discuss types, okay, then we are going to start about the classification of a drug which are used in the treatment of angina and mechanism of action, adverse effect and usage also we are going to discuss. So if you see that angina means as you know that it is called the chest pain. So common name is called chest pain. So why it is called chest pain? Okay, so we are going to discuss that why it is the name is called the chest pain. So let's see why it is called the chest pain. So before starting this definition, okay, before starting this definition, we'll see one diagram. If you see the diagram here, okay, so here you can see the diagram. You can see here this is called the aorta. From aorta, you can see the smaller arteries are originated. These are called the coronary artery. Okay, so these coronary artery, what they do, they supply oxygenated blood to all our heart muscle. So as our heart, okay, keeps pumping and pumping, okay, throughout our life without taking any rest. Okay, so our heart muscle require the huge amount of oxygen. It requires the huge amount of nutrients also. So who is supplying? This coronary artery is supplying. You can see here, okay, it's given as a number. This is the second branch, fifth branch, okay, third. So you can see further divided into small branch. So which mainly supply, okay, oxygenated blood. So always remember, okay. So what is called in angina? So in angina means this as a coronary artery, you can see here, these are very narrow artery. So there is a higher chance of blockage. So if a patient is having, okay, high cholesterol, or you can say that damage of, you can say that coronary artery due to hypertension or due to stress or due to any reason. So what will happen? So some deposition will happen. You can see here, suppose this is a coronary artery. Here you can see the yellow color, the fatty deposition is there. So this fat cholesterols are deposited and the arteries become harder and narrow. So once it become harder and narrow, then certain part of our heart muscle cannot able to receive oxygenated blood. So what will happen? So due to the lack of oxygen, lots of metabolites start, waste products are start accumulating here. So due to that, which mainly cause the chest pain. So you can see in the third diagram. So this is a coronary artery where you can see the coronary arteries are blocked here. So due to the blockage in the coronary artery, what is happening here? You can see the certain part of our heart muscle is not getting oxygen and the color becomes changed. So due to the reduced oxygen supply, the color of our heart muscle becomes changed and it has the accumulation of lots of metabolites and it has a chest pain. So mainly damage, okay, or stress is happening in our heart muscle, but patient can feel the, okay, pain in the chest. So this is about the common, okay, we can say that very common type of a cardiovascular disorder. So we'll see what is angina. So angina is, you can see that angina is a, okay, angina is a mainly type of a atherosclerotic disease. So what is called atherosclerotic? The meaning of atherosclerotic is that, okay, so this, suppose this is a blood vessel. In this blood vessel, so if there is, if any deposition happening like cholesterol, blood cells, okay, platelets are aggregated. So you can see this it start blocking. So it is called atheroma. It form day by day, okay, year. So if within, you can say, for long period of time, so around 1 year, 2 year. Okay, so when the lots of fats are deposited here, you can see in this area, so that is called the accumulation of, or you can say that deposition and form atheroma. So this, so which mainly cause the reduced oxygen supply. Suppose this is a coronary artery, suppose this is a heart muscle, so here oxygen supply become reduced and it is called atherosclerosis. So atherosclerotic disease, okay, also known as coronary artery disease, called CAD, okay, the common name, and it is also known as ischemic heart disease. What is called the IHD, we can say. Ischemic heart disease means when the oxygen supply to the heart muscle become reduced. So we can say it is called the ischemic disease. So it is one of the most causes of mortality worldwide. Which, so due to this angina, many patients suffer from heart attack, patients suffer from heart failure, and finally it may cause death also. For this reason, it is one of the most most common causes of mortality worldwide due to the cardiovascular disorder. So means this atherosclerotic, okay, some lesion will happen inside, okay, forms inside the coronary artery, and that mainly cause obstruction in the blood supply, and these okay the and cause the breakdown of atheroма, the smaller fragment which start blocking the narrow arteries. Okay, so we are going to discuss the type of angina. So there are different type of angina are there. So first we see that is stable angina. Okay, so we are going to discuss what is the type, why it is called stable, why it is called unstable angina. Okay, finally you can see that angina when it is not treated, when this okay, so coronary arteries are not clear, so it may cause myocardial infarction known as heart attack. MIU, you can see that it's called heart attack. So common name is called heart attack. So even it is called the heart attack. If it is not cleared, if a patient suffer continuous okay blockage in coronary artery, so it may cause the heart attack. Okay, so so we next okay, moving to the next slide. So same as we discussed that. So in angina, what is happening here? So due to the blockage, so there is called imbalance. So let's see what are the imbalance. So mainly, if you see that symptoms in the characteristics sudden, okay, so what will happen? Patients suffer from experience with sudden chest pain. Okay, you can say that all those neck pain in the neck, okay, lower jaw become okay very tight. Patients suffer from dyspnea, you can say difficulty in breathing, okay, indigestion, nausea, vomiting. Diaphoresis means feeling of okay uneasiness. So these are the you can say the common symptoms which we can see that a patient mainly suffer from due to the angina. So what is happening in the angina? Why we say that okay it is mainly known as angina? Why it is called the chest pain? So you can see the yellow, blue color. There is called the imbalance in myocardial oxygen demand. So myocardial oxygen demand means our heart muscle demand oxygen. So during contraction, during relaxation, while pumping the blood, our heart demand lots of oxygen. Who is supplying oxygen? Coronary artery is supplying oxygen. So heart muscle demand oxygen, and we can say that coronary artery supply oxygen, supply oxygenated blood. So we can say oxygen. So what is happening here? So there is imbalance in the demand and supply. If our heart is pumping very forcefully, our heart rate is higher, heart is beating faster. Okay, then what will happen? Demand become increased, and at that time, so coronary in the angina, coronary arteries are already blocked, partially blocked. So what is happening? The supply become reduced. So you can see supply and demand become imbalanced, and that cause the ischemia. Okay, reduce oxygen supply to the heart muscle, and it causes chest pain. So this is about the okay chest. Now you can see in this diagram. So what is happening here? Uh, okay, angina as you discussed that chest pain. If you see that in what why we suffer from chest pain. So what will happen? Or when our heart beats faster, when our heart contracts and relax, they demand oxygen. You can see oxygen demands become increased. Okay, so when oxygen demands become increase, when our heart rate increase, when the contractility means when our heart contract very forcefully, when our heart is contracting very forcefully. Afterload, okay, afterload and preload. This word will come okay after this slide. We'll see what is called preload, what is called afterload. So if you see that afterload means the returning, okay, returning the return of a blood inside the filling inside the ventricles, atriums, okay, the filling chamber, that is called afterload. Preload means whatever the blood that pumps into the arteries. So okay, heart creates lots of pressure into the arteries, so that is called the preload. Okay, so that is, so here you can see there is imbalance in demand. So here demand is increasing. Now who is supplying? As we discussed that coronary artery is supplying. The coronary okay coronary blood vessel is already narrow due to vasospasm. Okay, due to thrombosis. Thrombosis means as you know that formation of clot, or fixed stenosis, or you can say that okay the narrowing of blood vessel due to any you can say that deposition of lipids. So this is called okay supply versus demand. In angina, supply and demands are totally imbalanced. You can see supply become decreasing and demand become increasing. If there is okay imbalance in demand and supply, then patients suffer from angina. That is called the chest pain. Okay. So if you see this is called pathophysiology. So this is a normal artery. This is a normal coronary artery. So you can see the normal coronary, all those coronary arteries are very clear. Here blood can able to flow easily. Okay. But if you see that patient who suffer from angina, Okay, so lots of plaque. Plaque means you can say deposited fats, lipids, cholesterol, blood cell, platelets are deposited here. So due to the deposition in this area, what is happening? The blood vessel become very harder and narrow. So you can see this narrow area does not allow to supply the enough amount of oxygenated blood which our heart is demanding. So you can see, so that causes the chest pain. So that is called narrowing of artery due to atherosclerosis. Okay, so I hope everyone is clear about this example. So where we suffer from angina? So mainly we suffer from chest pain due to coronary artery. So always remember it is a coronary artery disease. Okay, moving to the next slide. So as we discussed already in the diagram, these are the coronary artery and how we suffer when coronary arteries are blocked any part. So in that area, you can see that the heart muscle is okay. You can say become bluish in the color due to reduced oxygen supply, and that is called the, you can see that angina. So we'll see the types. What are the types of angina? So mainly there are three types are there. Stable angina. Name only indicate that stable, or you can say effort induced. Okay, or you can say classical, or you can say typical angina. You can see here the patient. Okay, here a patient is mainly climbing on a stair. Okay, so doing exercise, or you can say he want to go on first floor, second floor. So means when a patient is sleeping or patient is sitting or patient is not under sympathetic activation or not doing any physical exercise, then they does not feel any type of chest pain. But when a patient is start okay any type of physical exercise like climbing stairs or walking or running, then what will happen? So when we do exercise, our sympathetic nervous systems are activated. If our sympathetic nervous systems are activated, then what will happen? Our heart rate increase. Heart rate increase, force of contraction of our heart muscle become increased. So when force of contraction increase, heart rate increases, our heart is demanding more blood supply, but our coronary arteries are already partially blocked. Okay, already blocked. So which does not allow the supply of sufficient amount of blood. So patients suffer from okay angina. So that is called stable angina. So stable anginas are mainly seen during physical exercise. Unstable angina, or you can say pre-infraction angina. So it mainly this type of angina is mainly seen to those patients if it is acute type. Okay, suddenly patients suffer from angina due to the stress, due to the okay due to any reason. Okay, suddenly due to the increased heart rate, okay, heartbeat, or you can say due to the increased blood pressure. So unstable means it is not stable. Okay, suddenly a patient suffer, that is called acute syndrome. Okay, suddenly patient is when it is a very serious type. Why it is a serious type, we are going to discuss that. Okay, then next one is called the variant or vasospastic. Okay, vasospastic, or you can say rest angina. They are mainly caused by combination and which may increase the demand of our heart and oxygen supply become reduced and cause angina. Okay, so this is the different, you can say that the type we discussed. Now moving to the next slide, if you see stable angina. So most common is called stable angina, which is around 90%. Okay, patient mainly suffer from stable angina where blood flow to the myocardium become decreases. Okay, so due to the occlusion means blockage in the coronary artery. So what is happening here? The coronary arteries are mainly blocked, and you can see that this is known as a okay. So stable angina. So it mainly exists around 1 to 15 minutes. When again patient is taking a rest, then this chest may become disappear. So it may be due to the exercise, due to the stress, due to the steam, cold, hot, or heavy metal, or due to alcohol, due to smoking. So alcohol and smoking also increases our heart rate. Okay, so that may be so relieved by nitroglycerin tablet, that is called vasodilator. We are going to discuss what is called nitroglycerin. So all those things we are going to complete in this topic only. Now moving to the next slide. So I hope everyone is clear about this stable angina. Now moving to the next slide, that is called unstable. So unstable is called, just to see name is called acute okay, coronary syndrome. Syndrome means the combination of different symptoms. So what is the causes of unstable angina? So what is happening? So due to the high pressure, the plaque, or you can say that atheryoma. So what will happen? Suppose this is called, suppose this is known as artery. This is called coronary artery. Here, here some blockage is there. So due to some okay, due to some any reason, okay, suddenly due to the high pressure, these atheryoma become broken. When it is a broken, then lots of smaller fragment forms inside the blood, and these fragments start blocking the fine cap okay blood vessel, and that is, and it is a very serious. Okay, so so this is called the unstable angina. Okay, so you can see here the plaque ruptured means the breakdown of a plaque means always remember the deposited fats lipids inside the coronary artery. Coronary artery causing blood clot and partial blockage for blood flow of a heart such as chest pain. So this is about the unstable. Okay, so pathology is very similar. So that mainly involve, okay, so mainly myocardial infarction. Mainly patients suffer from due to unstable angina also. Okay, so chest pain occurs due to increased frequency duration. Okay, so this is about the, you can say, unstable angina. So in unstable angina, what is happening? So as we discussed that it is a very acute. Okay, suddenly patients suffer from, okay, acute angina. So what, okay, so due to the rupture of plaque, so all those deposited fats, lipids are deposited, or clots are deposited, become broken and become smaller fragment and start blocking the capillaries. Okay, sorry, blood vessels of a coronary artery. Next one is called a variant or spastic. Vasospastic means here the blood vessel become very narrow. Okay, in some area become narrow like this. It become like this. So it is called vasospastic. Okay, this, suppose this is a normal blood vessel, in certain part of blood vessel, okay, it's become like this. Okay, it's become like this. Okay, so that is called the vasospasm. So you can say the spasm of, you can say that tunica intima, okay, or tunica media, so become narrowing. So it is a uncommon episode. Okay, symptoms are mainly caused due to the decreased blood supply to the heart muscle. Okay, so this is about the vasospasm. So where the blood vessels are very narrow, mainly coronary arteries are very narrow. That is mainly treated with the help of different drug like beta blockers, or you can say calcium channel blocker. Now we'll see that the what is happening here. So in the diastolic factors, what will happen? The blood volume. When the blood volume increase, so what will happen? When the venous tone, okay, so venous returns are increased. So that so in our mic, so more blood is mainly filling inside our heart chamber. So what will happen in heart chamber? The tension, or you can say the pressure become increased. Peripheral resistance. When the peripheral resistance increase, then also our heart have to work extra. Peripheral resistance means our blood vessel. When our blood vessels are narrow, then you can say peripheral resistance. Resistance means opposing force. Then you can say that opposing force is very higher. If our blood vessel is wider, then you can see here in wider blood vessel, the resistance is very low. Okay, so heart load also become decreases. So when our heart rates are increases, then also our heart, okay, works extra. When a force of contraction of our heart increases, plus means increases, just you see this diagram, then also our heart, in our heart the tension increase, or you can say stress is ejection time, ejection fraction. So ejection fraction is the amount of like cardiac output. If our heart is pumping more blood, so it is working extra. So what will happen? This is called the demand of our heart. So our heart is demanding more and more. Okay, so this is about the myocardial hypertension. So what will happen? The myocardial demand become increased. So how we can treat? We can treat angina by decreasing demand or by increasing supply, or both. So if you are decreasing the demand, then we have to decrease the heart rate. We have to decrease the force of contraction. We have to decrease the, okay, force of contraction, demand, heart rate. Okay, how can increase the supply? You can increase supply by giving vasodilator, the drug which mainly helps in the widening of our blood vessel, that is called vasodilator. Vasodilator. So now moving to the next slide. So already we discussed that. So these are the factors how we suffer from. So due to the exercise, due to the emotion, stress, or due to the sex, what will happen? Our sympathetic nervous system is fight and flight mode. Okay, sympathetic systems are activated. When our sympathetic systems are activated, our heart rates are increased. When our heart rate increase, the contraction force become increased. Okay, wall tension. Okay, so in our heart, the pressure become increased. So total peripheral resistance are also increasing. Our blood vessel become in our blood vessel the pressure is very high. So that increase the work of our heart. So when work of our heart increases, that increases the myocardial demand. Just to see. So when the myocardial demands increase, and already myocardial supply, that is called coronary arteries, are already blocked. Now you can see there is no balance of demand and myocardial supply, and it causes ischemia, reduced oxygen supply, and patient suffer from, so that cause a chest pain. So it cause chest pain. So very simple, okay, flow chart we okay here included in this okay slide. Now we'll see that next. So moving to the next slide. So now therapeutic strategies. What are the different strategies which are used for the treatment of angina? So already we discussed that. So either we can increase the blood flow means in coronary artery. So if we in angina we are only discussing about coronary artery, not other blood vessels. So increase blood vessel, increase the blood flow to the ischemic heart muscle. So we can treat by increasing the blood supply to the ischemic heart. Ischemic means where the oxygen supplies are very reduced, or decrease the myocardial oxygen demand. So we can also treat okay, angina by decreasing the demand of myocardial okay demand. There are four type of drugs are available, okay, either in the combination or alone it is used. Beta blockers are there, calcium channel blockers are there, nitrates are there, okay, some new drugs are there. We are and statins are also there. Statins means which are going to in lipid lowering drug, which also decrease the cholesterol level. Okay, antiplatelets drugs are there, which mainly prevent from clotting of blood. Thrombosis, heparins are used. Okay, so different drugs are used. We are going to discuss one by one. So even aspirins are also widely used for the treatment of angina, and also in prophylactic use also it is okay given. So if you see the classification of anti-anginal drug, so first we will see that nitrates. Okay, if you see that nitrates means okay GTN we can say. GTN means nitroglycerin tablet. These are mainly available in the sublingual form, as the drugs are lipid soluble, so patient have to keep below the tongue. So what will happen when a patient experience chest pain at that time, they have to take okay, or for prophylaxis also we are giving GTN. Suppose patient is going for physical exercise, so we discuss that when a patient do physical exercise, then they suffer from chest pain that is stable. Or when suppose a patient is suffering from angina, he want to do gardening, or then so what will happen, their coronary arteries are already narrow, and when they do any physical exercise their heart demands more, then what will happen, so they suffer from chest pain. So patient have to keep one sublingual tablet. These tablets are designed like that their absorption is very faster from sublingual route, and it directly goes to the blood circulation and has the dilation. So like examples are nitroglycerin tablets are there, isosorbide dinitrates are there. Okay, so these are the drugs. So what is called nitrites? Okay, this releases nitric oxide. Nitric oxide is a type of a okay the chemical which are mainly released in our blood vessel. These are the potent, very powerful vasodilator. Okay, next drug is available in the form of beta blocker. So like propranolol, they decreases our heart rate and force of contraction. All those beta blockers are mainly acting in our heart, block beta 1 receptor. So once a beta 1 receptors are blocked, then heart rate, force of contraction become decreasing. Metoprolol, atenolols are there, and other drugs are also used. Calcium channel blockers mainly amlodipine, nifedipine. Okay, okay, you can say that nitrinidipine, diltiazem, verapamil. These drugs are widely used for the treatment of angina. So that also we are going to discuss already. So means this nitroglycerin we have not completed in antihypertensive, but beta blocker, and you can see about beta blocker, about calcium channel blocker. You can also watch my video, the previous video, that is for antihypertensive drug. Next, now we'll see that. So what will happen to the if you give to the nitrates? If you give to the nitrates to the patient, so already as we discussed that due to the nitrate, what is happening here? Okay, so the nitrates are mainly helping. So preload reduction means peripheral cooling of the blood, so that decreases venous return. So if a venous return in our heart chamber become decreased, so our heart does not have okay no need to pump extra. After load reduction means the pumping. So nitrate also produces some atrial dilation. So all those our arteries are dilated. So what happens? So pressure inside the artery become decreases, then our heart does not have to create the extra force. So slightly decrease the total peripheral resistance or after load to the on heart. Okay, redistribution of coronary flow. So all those arterial tree nitrates are mainly relaxing that all our you can say coronary artery and become dilated and decreases the resistance. Okay, so this is about the mechanism. This is about how the drugs work. We'll see the mechanism of action, how a drug is okay producing. So very simple. So all those nitrates, okay, nitrates, they are the prodrug. Prodrug means it is inactive. When we take, okay, when it goes into systemic circulation, become active. So it produces nitric oxide, NO, activate the soluble isoform guanylyl cyclase. These are the secondary messenger. So they increase the formation of CGMP. Okay, so CGMP are the secondary messenger. So they are helping the relaxation of vascular smooth muscle and blood vessel become, okay, dilated. So always remember CGMP. What is CGMP? Just remember it is a secondary messenger which are helping the relaxation of vascular smooth muscle and cause of vasodilation. Okay, so that mainly, so that is the relaxation and cause vasodilation. So very simple mechanism. Okay, now moving to the next slide. So this is how the nitrates work. So mainly the mechanism of nitrate, if you see that. So what the nitrates do? Nitrates are mainly increasing. So when the nitric oxides are released, that start the formation of CGMP. Okay, these are the secondary messenger and mainly cause the relaxation of vascular smooth muscle. This is a smooth muscle. Okay, this is a or you can say tunica media. So vascular smooth muscles are relaxed and cause dilation. Calcium channel, if you see that when any calcium ion enter in our smooth muscle, then what will happen? Our muscle become contracted. Okay, so due to the calcium entry. So if you give a calcium channel blocker, channel means the gate through which calcium enter. So that gates are blocked and calcium cannot enter inside the tunica media, and that causes the relaxation of okay, vascular smooth muscle. So calcium is a positive charge. Always remember, on calcium there is positive charge. When this positive charge enter inside the muscle, so that increases the electrical current. Okay, muscles are excited and contracted and cause the vasoconstriction. Similarly, all those amlodipines are, if we use, okay, used. So this diagram, if you see, diagrams look little complex, but it is a very simple. This diagram, okay, in the middle part, the red color, you can see this is a smooth muscle of our blood vessel. Okay, so in the blood vessel, when you take, okay, nitrates, okay, like nitroglycerin tablet, GTN tablet, okay, which are widely used in the treatment of angina. So this GTN tablet, when we take, so it releases nitric oxide in the muscle, in the tunica media. So this start the formation of CGMP and cause, okay, vascular smooth muscle relaxation. When you give calcium channel blocker, so calcium entry inside the vascular smooth muscle decreases and cause of, okay, relaxation and cause vasodilation. Now moving to the next slide. Pharmacokinetic, if you see, the nitrates means organic nitrates are lipid soluble, as you discussed. All lipid soluble drugs, mainly our cell membranes are also made up of lipid. So for this reason their absorptions are very faster. Okay, so mainly it is absorbed from, okay, buccal mucosa, okay, intestine and skin also, but we are giving the sublingual route because sublingual is a faster routes of absorption. Okay, so ingested orally or except isosorbide dinitrate. Okay, so that is mainly absorption start and cause of vasodilation. So adverse effect, if you see that what are the adverse effects, so it may cause headache. Why it cause headache? Because of vasodilation. Okay, so most common adverse effect is nitrate higher dose mainly can cause postural hypotension. What is called postural hypotension? So postural hypotension means, okay, suppose a patient have taken nitrate and patient is lying on the bed sleeping. So when suddenly they stand or when they sit on the chair, then what will happen? They suffer from hypotension, dizziness. Okay, so hypotension can be managed. So you can give a nitroglycerin tablet when patient should be an, okay, standing, sorry, and sitting position. So patient should have to sit on chair, so that can be minimized. Okay, so this is about the so this is called the adverse effect. And one more thing, these nitroglycerin tablets are never given with sildenafil. Sildenafil means this is a type of a vasodilator, okay, which are mainly used in erectile dysfunction. The brand name are Viagra, you can say. So patients who have taken a nitrate, they should not take a sildenafil tablet like Viagra tablet because it causes a dangerous hypotension. Actually, the sildenafil, or you can say that Viagra tablet, which are mainly available, which mainly used for erectile dysfunction. Okay, so sexual erectile dysfunction. So it is called vasodilator, and nitrates are also vasodilators. So both drugs mainly they potentiate each other, and patients suffer from very, okay, severe hypotension. For this reason, these drugs are never given together. Okay, so patients should avoid this. Okay, so tolerance, patients suffer from tolerance also. So tolerance means suppose a patient is taking first month, okay, 20 mg, or you can say, then up third month patient require 30 mg, 40 mg. So day by day body require higher and higher dose, and dependence. Okay, patient is mainly dependent on this. Okay, so that mainly cause withdrawal effect. So without this drug, patient starts suffering from chest pain. So due to the prolonged exposure, due to the prolonged use, okay, long term use, so patient may suffer from dependence. So this is about the okay nitrates. So usage, if you see that where it is used in angina. So GTN is a short form, okay, nitroglycerin produce a relief within 3 minutes. Just you see, within 3 minutes it starts, okay, mainly provide relief from the chest pain. 75% of patient may require another dose or take, okay, up to 9 minutes. So mainly patient can take a repeated dose also. Okay, in acute condition, it means sudden angina due to the stress, temperature, as we discussed. Nitrates are very useful for decreasing the preload. So already discussed, preload means the venous return. Afterload means all those blood which enter into the blood peripheral artery. In myocardial infarction also given, suppose a patient is suffering from chest pain due to the severe blockage. So if we give a nitroglycerin tablet, so we can able to save the patient by maintaining, by causing a vasodilation, so which can able to supply the blood to the heart muscle. Now moving to the next slide. So where it is used? So it is used in congestive heart failure. Nitrates are also used in CHF. Congestive heart means so when a patient suffers from heart failure, means heart muscles are weak, cannot able to pump the blood. So that is called, and lots of fluids are accumulated. That is called congestive heart failure. And acute left ventricle, okay, left ventricle failure. So when left ventricle can unable to pump the blood, in that cases to reduce the heart load, only nitrates are given. Okay, so which reduces the heart load by reducing preload, reducing the venous return, decreasing the diastolic end volume, improvement of left ventricular function. Biliary colics means, okay, so blood vessel which mainly coming from, or you can say biliary colic means uh, the duct which mainly collect the bile. So that is once when it become a contracted, then patient may suffer from a pain. So that is also mainly treated with the help of, okay, this nitrate. Esophageal spasm, when a patient suffer from, okay, narrowing of esophagus, then also it is used. In cyanide poisoning, nitrates are used. Okay, nit generate lots of methaglobulin. Okay, so these are about the uses. So calcium channel blocker already you have completed in antihypertensive drugs. So mechanisms is very similar. So mainly prevent the entry of calcium and cause the relaxation of the mainly heart muscle, so that decrease the force of contraction. Even it is also mainly cause the vasodilation. Mainly verapamil are widely used. Verapamil deltizam. Okay, moving to the next. So already we discussed that in heart, calcium influx means entry of calcium ion inside the heart muscle become reduced. Okay, so force of contraction become reduced. So these are called the calcium channel blocker. So you can see this video in antihypertensive. A video already I have uploaded that. Adverse effect, if you see that calcium channel blocker, mainly palpitation. Patients suffer from sudden, okay, a very sudden increase in heartbeat, and also mainly very, you can say that very forceful, or you can say that louder sound. Flushing means redness of, you can say facial, ankle edema, swelling in the leg, hypotension patients suffer from, headache patients, okay, suffer, drowsiness, nausea, okay. So these are the common adverse effects of calcium channel blocker. The uses already you have completed in angina. Okay, so if they are using angina pectoris, hypertension, in cardiac arrhythmia also, okay, hypertrophic cardiomyopathy, means enlargement of mainly ventricle size, as you discussed that. So in that also it is used. So some new agents are there. Mainly you can see that dipyrimidamole. Okay, so these drugs are mainly powerful. Okay, dilated. These are the new drugs. Okay, trimetazidine. Okay, these are the anti-anginal, new anti-anginal drugs. So mechanisms are, okay, mainly that inhibit the mitochondrial, or you can say that this trimetazidine, this drug, what they do, they mainly allow the utilization of glucose to the heart muscle, so heart muscle can get more energy from glucose. Okay, so that is mainly that block the pathway of fats, lipids. Okay, and ronelazine is also mainly, it is called the sodium channel. Okay, you can say that inhibit the late sodium channel. So once the sodium channels are mainly blocked, sodium cannot able to enter inside the heart muscle. So that also reduces the that causes the relaxation of you can say that heart muscle, or reduce the force of contractility. Ivabradines are similar action. Okay, So it is alternative to beta blockers. Okay, so that is called ivabradine, anti-anginal drug. So how it works? That also reduce the heart rate and force of contraction. Oxypyridine improve mainly myocardial metabolism, so that can able to get mainly ATP, convert ATP from the carbohydrates like glucose. So these are the okay newer anti-anginal drugs which are recently added into the therapy. Okay, so all these about the anti-anginal drug. So we have completed angina symptoms. We discussed the types of angina. We discussed about the classification of drug. Then we discussed about the mechanism of action, pharmacokinetic. Mainly we discussed more about nitrates. The remaining about beta blocker, calcium channel. You can also watch my okay all this uh, okay about calcium channel about beta blockers. You can watch in my next video of antihypertensive. So thank you for watching. Please subscribe my channels. Thank you.